For our in-person visits, we are trying to mitigate all risks and decrease waiting room, and also make sure that you're coming to the most appropriate area so that we use the full clinic.
Hey, Lieutenant Michael Dubois, proud member of St. Carlos Apache Tribe, Chief of Logistics here at Fort Yuma Health Center. In today's episode, we're going to take you behind the scenes and introduce you to our primary care team and how we're going to help you continue having services during the COVID-19 pandemic.
Hello, I'm Dr. Camlesh Nirmul, the Clinical Director here at the Fort Yuma Health Center. I'm going to walk you through the steps that a patient would go through to be seen in our primary care clinic. The steps that happen is once we have talked to you, if we've determined that you're going to do an in-person visit, we tell you to, one, wear a mask. When you come, you're going to come and stop in our tent area in the front. You will be screened for COVID symptoms. Your temperature will be checked, and then we will confirm that you have a visit with us. Once we have decided that it's safe for you to enter the building, we'll go ahead and have you check in for your appointment. You'll come here to the primary care clinic and see our front desk people. They'll just check that you've got your appointment in, check you in, and then they will contact our clinical staff in the back to alert them that you have arrived. Our clinical staff come out right away because we do want you to not have to wait. We'd like to get you to the room as quickly as possible. They'll walk you to the back. We will do the screenings that are needed, and they'll get you into a private room immediately. Then the provider, your primary care provider, will come in, do the visit, and if you need any other services during the visit, we will arrange for that to be in the room as much as possible, including blood draws, pharmacy, any other people who you need to talk to. We're going to try to bring them over to the clinic for you. We do try to, for our in-person visits, we are trying to mitigate all risks and decrease waiting room, and also make sure that you're coming to the most appropriate area so that we use the full clinic. As a result, we do have 3 clinical areas. In particular, there are 3 separate doorways and 3 separate waiting areas. If you are a well child, in particular, you're 0 to 24 months, we want you to be in the safest possible clinic visit that we can arrange. You have dedicated rooms and a dedicated waiting room, which we call our Pod C area. So for all of our little babies, we're having them come in separately to a separate area. If you have infectious symptoms, not COVID related, but you're sick, we have a separate pod for you. You'll come in a separate door, you'll be seen in those rooms, and that way we can make sure that anybody infectious is not being around anybody who's actually well. So we're really trying to do our best to spread out our visits, keep everybody as safe as possible, keep the infection control risks low as possible, and really mitigate COVID exposure.
Hello, this is Dr. Nirmul at the Fort Yuma Health Center.
For those of you that are doing phone visits, or you will have a phone visit with your primary care provider, usually you initiate that by calling us, asking to speak to the team. The medical assistant or the nurse is going to talk to you, find out what your needs are, kind of determine what can we do in advance of your visit. And if we can, we will try to do a full telephone visit. Your provider will then call you and go through the visit as if you were there in person, just doing it on the phone. If at any point they feel like they need to see you, they will do that. But otherwise, if we can take care of your needs on the phone, we will complete that.
In today's episode, we took you behind the scenes of our primary care team. For more information, please call 760-572-4100 or visit us on Facebook to find more information.